So our third stop is going to be talking about health insurance. With health insurance, there's a lot of lingo that is used, so I want to go over a few of the words that you're going to see quite frequently. The first one is premium, and that's the amount that you pay every month to have the health insurance. You have your deductible, which is the amount that you need to pay every year before the insurance company begins to split the cost with you. A plan summary is an outline of the services, your deductibles, your copays, and your co-insurance. A co-insurance is the amount that you're required to pay after you meet the deductible. So once you've met the deductible, the insurance company will split the cost with you. Your portion is called the co-insurance. And then there's a copay, which is a fixed amount that you pay every time you go for services. And the last one is EE for employee and ER for employer. So we offer a variety of plans. As you can see, we have two Anthem PPOs. One's called Key Advantage 250 and the other is Key Advantage 1000. And we have our Anthem High Deductible Health Plan. And then we have our HMO, which is with Kaiser Permanente. And one really important thing to note before we get started is that when you pick one of these plans, it is going to include your medical, your dental, your vision, and your prescription coverage. So each one includes all of those items. I'm going to show you just a really quick video. I think it does a good job of explaining the differences between the PPO, HMO, and HDHP, and hopefully it will help you pick which plan is going to be best for you and your family. This will be on a Google link, and on that Google link, you'll have access to any hyperlinks that I have on this, as well as videos.
When choosing a medical plan, you sometimes have the choice of picking between an HMO, PPO, or HDHP plan. Let's talk about what these letters mean and the key differences in these types of plans. First, an HMO, or Health Maintenance Organization, is an insurance plan that may offer lower monthly premiums, the cost for the insurance, but also gives you fewer choices regarding where you can receive care. The insurance provider has a list of approved doctors for you to choose from to receive coverage, meaning there are some doctors you cannot visit using your HMO plan. With an HMO, you must designate a primary care physician, or PCP. Think of your PCP as the main doctor you visit for routine medical care. With most HMOs, you must first visit your PCP and get a referral to see any specialists you may need to visit. And with an HMO, every time you see your primary care physician or a specialist, you pay a predetermined flat amount called a copay, no matter how many times you visit. A PPO, or Preferred Provider Organization, is a plan that gives you more freedom to choose from a larger pool of providers, but generally comes at a higher monthly cost. While the network is larger in a PPO, there are still providers that don't fit in. You can choose these out-of-network providers and get some coverage. However, you usually end up paying more for those services. PPOs do not require a primary care physician, therefore eliminating the need for referrals and giving you the ability to go directly to a specialist. Finally, an HDHP, or High Deductible Health Plan, is a different type of plan altogether, aimed at giving you the most control over your health expenses. HDHP medical plans typically offer the least expensive monthly cost for coverage, but require you to pay all of your healthcare costs that are incurred until you meet the deductible that is listed on the plan. These plans keep your costs low if you don't utilize it a lot, but keep you financially protected in cases of catastrophic illness or emergency. HDHPs are similar in structure to a typical car insurance policy. For example, if Bob's Auto says it will cost $5,000 to fix your car after an accident, and you have a $2,000 deductible on your auto policy, you will be required to pay $2,000, and the insurance company will pay the remaining $3,000. The higher the deductible you choose for your medical plan, the smaller the monthly cost will be. But it also means when you have health expenses, you are responsible for all the costs up to that deductible amount. Generally, HDHPs use what is called coinsurance to determine how much you pay for services after you meet your deductible. This is the percentage of a bill that the insurance company will pay at that time. For example, after hitting your deductible, if you get a medical bill for $1,000 and your plan has a coinsurance benefit of 80%, the insurance company will pay $800 and you must pay $200. coinsurance eventually stops and the insurance company starts to pay for 100% of all healthcare expenses when you have personally spent the amount listed as the out-of-pocket maximum on the summary of benefits for your HDHP plan. To sum it up, HMOs offer lower monthly premiums but limit the choices you have for doctors. PPOs offer more choices for doctors but typically cost more on a monthly basis. And HDHPs provide the most flexibility for you to manage your healthcare costs, typically offering the lowest monthly premium but requiring you to reach a deductible before benefits become effective. And now you know the differences.
Okay. So now that we've gone over the difference between the PPO, the HMO, and the high deductible health plan, I just want to go over some general health insurance information. You have 30 days to submit your form and any supporting documents. If you miss the deadline, you do have to wait till open enrollment, which is typically in April, or if you have a qualifying event, such as the birth of a child, to enroll. And just so everyone knows, our plan year runs July 1st through June 30th, just in case I ever mention that down the road. Your coverage is going to take effect the first of the month after a 30-day waiting period. So if your hire date is 8/10, your waiting period is until September 8th. And if you turn your forms in prior to the end of September, then your insurance is going to start on 10/1. Now we're billed a month in advance, so we deduct a month in advance. And really this 30-day waiting period is great because then you don't have to have double deductions taken for your first month of coverage. So just using the example above, the deductions that are taken from your August paychecks are going to be paying for your October insurance. If you're going to be adding dependents, I do need supporting documents. If you're going to add a child, I need a birth certificate. And if it's a spouse, I need a marriage license. And then down here is the link to the enrollment form, which I'm going to go over with you. Again, this is going to be on the Google Doc and a PDF so that you have access to the links as well. So when you look at this form, you're going to go to the third page. You're going to be putting in your social security number, your name. You're going to be marking off that you understand that you cannot make a change until open enrollment. You're going to sign in date and then choose one of the following. In part 2, you're going to mark off letter A, and you're going to put in your date of hire. And your date of hire is your first day of work. It's not the day the offer is made to you. So your first day of work is what you're going to put here. Now on the third part, it's going to be all of your personal information here. And then in part 4 is where you tell me whether you do or do not want health insurance. If you do not want it, you need to fill out letter A and put in the waiver information. If you want to enroll, you're going to fill out part B and pick the plan. Now, I just want you to note that there are some plans here that we do not offer. This is a state-run program, and we can only offer 7 of the plans that they have. So we do not have the expanded, we do not have the 500, we do not have the Optima Health. So all the other ones is what you can choose from. 250s, 1000s, high deductibles, or Kaiser. And you're going to put your information here in this first line, and then following that, any dependents that you're going to put on your plan. Then below that, leave everything blank because I'll fill out the rest for you. Here are our insurance rates. You can see on the left-hand column here, I have all of the plans, and then I have it broken down by coverage level. So it can be you plus one person, or family. Then I have the full monthly premium, and then followed by the amount that we as the employer will pay on your behalf, and then the amount that you are going to be paying every month. Now, please note that these are monthly amounts. You get paid semi-monthly, so you're going to have to divide it in 2 to find out your per pay amount. Kaiser is our HMO plan. It's, I guess the monthly premium is pretty comparable to the PPOs. It does not have a deductible to be met, which is great. It does have your copays and co-insurance. It's really easy to use. There's facilities all over, as you can see on this map here where they're located. They're popping up all over. I think they're actually building another 3 in our local area. So it's really easy to use. You pick which facility you want to go to. You elect a primary care physician, and then that primary care physician helps you facilitate and coordinate all your health services. So on site, they have everything from radiology, pediatrics, to OBGYN, and more. If you need a specialist that they do not have, you do have to have a referral to be seen. And as I mentioned before, all of our plans include medical, dental, vision, and prescription. So if you choose our Kaiser plan, you're going to have Dominion National Dental as your dental provider and Vision Essentials by Kaiser as your vision administrator. And then you can click down here to view the plan summary. If you choose our Kaiser plan, they have a mobile app. They have a little alert that can remind you to take your medication. They have, if you're traveling away from home, a travel line that you can call. One important thing to note about this plan is it is a local plan. So if you have, let's say, a student who's going away to college in another state under the age of 26 and you want them on your plan, this is not going to be the plan for you because they would have to come back and be seen at one of these local facilities for the coverage to take effect for services. So Anthem might be a better plan for you if you have that. They have wellness coaches. They have video appointments, so you can do it via Skype, Zoom, on your phone. They have all sorts of options, and it's been really nice with the current environment that we're in. If Spanish is your primary language, they have lots of materials. They also have a maternity program as well. Now we're going to talk about our Anthem plans. So there's PPO plans and the high deductible health plan. And when you look at our plan summaries for our Anthem plans, you're going to notice that all the services are the same. The difference between them is going to be in your premium, your deductible, your copay, and your co-insurance. And when you get your cards, you're going to receive one card. Well, actually, you'll receive two cards, but both cards are going to have your name on it because you are the policy holder. And you're going to use that for any medical appointments, dental or vision appointments, as well as prescriptions. So that one card covers everything. If you have dependents, they're going to be using the card that has your name on it as well because you are the policy holder. And if you choose an Anthem plan, you're going to have Blue View Vision as your vision administrator, and you'll have Delta Dental of Virginia as your Delta administrator. And you'll notice that with our Anthem plans, there's two of each. One says preventative and one says comprehensive. And that's because the Anthem plans allow you to pick the level of dental coverage you want, which we'll go over in just a minute. So as I mentioned, all the plans, all the Anthem plans have the same services. So here's just a look at a plan summary. So you're going to see all of these items here on the left-hand side are the same for all of these programs. The difference is going to be in your deductible, your copay, and your co-insurance. So with the $250, your premium is higher than the $1,000 in the high deductible health plan, but your deductible is lower than the $1,000 in the high deductible health plan. And also your copays and co-insurances are a little bit less too. If you elect the $1,000, your premium is going to be lower than had you picked the $250, but higher than the high deductible health plan. And the deductible is going to be higher than the $250, but lower than the high deductible health plan. If you choose the high deductible health plan, your premium is going to be the lowest. It is cheaper than the $250 or the $1,000. And the reason why is because it has the highest deductible in place. Here are the plan summaries. And again, on that Google link, it will be a PDF, so you'll be able to access these links. Here's the outline of what a comprehensive versus preventative dental. When you enroll in your Anthem plan, Delta Dental is going to be your dental administrator. And you need to decide whether you want to do preventative or comprehensive coverage. Now with the preventative, which is right up here at the top, you're going to notice that the premium, the monthly cost, is going to be less. The reason why is because it really only covers, your 2 cleanings, an x-ray, and a fluoride. So if you get a cavity, need a root canal, that's not going to be covered under your dental coverage. You would need to pay for that. The comprehensive plan, which is down here, does cost a little bit more every month and does have a small deductible, but it includes all these preventative services. And if you have any primary dental care things that happen, so again, cavity, chipped tooth, they're going to pay 80% of the cost, leaving you only 20%. Major dental 50, leaving you 50%, and then there is some orthodontic coverage. So when you're looking at this and you're looking at the plans, just know that that's why there's a comprehensive and a preventative. And then I have this brochure here as well in the link. Anthem programs. They have a Future Mom program, so if you enroll in the plan within your first 16 weeks of becoming pregnant and have your teeth cleaned, they will have a 24-hour nurse available for you. I believe they still send you a book of weekly things that are happening with the baby. And if you enroll in the Key Advantage 250, then and participate in the program, then they will waive the hospital fee for you, which I think right now is about $400. They have a lot of information on chronic conditions, 24-hour nurse. They have a health library. They also have a mobile app. They have Live Health Online. So again, that's where you're Skyping or Zooming with your doctor, so you don't have to go in the office. One of the cool things about Anthem is they have, just your normal doctor, but they also have psychologists and psychiatrists that are available to do video appointments. They do home delivery for your pharmacy, so if you can get a 90-day prescription, it can get mailed right to your house. You don't have to wait in line at Walgreens or CVS. And one of the cool parts about this program is that you only get charged for 2 months worth of prescriptions, so you get 1 month free. And then they have a global care program. Now this program, just so you know, with Anthem is one that is accessible all over. It's not just a local plan. If you have any questions, please let Debbie or I know.